and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
Jean Marie is not with us again, and collectively we're the host of PodcastDX. On today's episode, we will be discussing rheumatoid arthritis with a guest that we had previous on a show. This is Amee. She's the host of One Broken Mom, which is her own podcast, and she's going to be talking to us about rheumatoid arthritis, which she developed due to a chronic, what was the ACEs stand for again, Amee?
Adverse childhood experiences.
Adverse childhood experiences. So we're going to kind of combine these two shows together, but first we gave you an idea of what ACEs was, and now we're going to talk about the rheumatoid arthritis that followed up with it. Thank you for joining the show again, Amee.
Yeah, thank you for having me. I'm grateful for the experience.
So could you start us off by just telling us what is rheumatoid arthritis?
I would love to. I start to really quickly that a lot of people, when they hear the term arthritis, they tend to think of the more common osteoarthritis, which is what we get from wear and tear, of the joints and stuff. And so there's not a lot of information or understanding about rheumatoid arthritis. Mayo Clinic does a really good job of defining it and describing it. And so for everybody out there, it's an autoimmune disorder, and it occurs when, for some reason, your immune system mistakenly starts to attack its own body tissues. And it's a chronic inflammatory disorder that actually goes beyond just the joint and can affect other parts of the body.
Oh, so how does it affect the rest of the body?
Well, so when the immune system has been told against some sort of a trigger that it needs to attack, it particularly goes after the synovium, which is the lining of the membranes that surround your joints. So I always describe it as, think of it as the lubricant of the joint.
Okay.
Mm-hmm. And that inflammation that can happen when it's under attack is not unlike spraining your ankle and your ankle swells up, right? It gets all swollen and puffy. Mm-hmm. With rheumatoid arthritis, you get that inflammation all the time because of the signal from the immune system. Oh. And when the joint has that synovium always under constant inflammation, it actually begins to destroy the cartilage and the bone within the joint. Ooh. And then what can happen is that the tendons and ligaments that all come in together that hold the joints and our bones together actually can become weakened, and they can stretch. And then the joint will actually start to lose its shape and alignment, and then you start to see the deformations that a lot of people are familiar with when they see somebody that has an arthritic condition.
Okay.
That's correct, and doctors don't know what actually starts this process, although a genetic component appears likely. While your genes don't actually cause the rheumatoid arthritis, they can make you more susceptible to environmental factors such as infection with certain viruses and bacteria that may wind up triggering the disease. I mean, you mentioned that rheumatoid arthritis can affect more than just your joints. What else can it affect?
Well, again, Mayo Clinic has a really good breakdown of all of these things in case people want to refer back to this list. But what rheumatoid arthritis can actually begin to affect is a bunch of the non-joint structures in our body. For example, your skin, your eyes, lungs, heart, kidneys, the salivary glands, nerve tissue, bone marrow, blood vessels. I've even seen and heard of conditions where it gets into the, bowel issues. Oh. In my case, I have experienced a syndrome called Raynaud's, which is a disease or disorder that can be a companion to RA. And what this means is that if my core body gets cold or chilled, then I start to experience cold fingers or toes that go completely numb with no feeling in them at all, color changes in my skin in response to this cold or stress, like they become white, and numb prickly feelings and stinging sensations when my fingers and toes actually start to warm back up.
Oh, okay.
Oh, wow.
Okay. So that's like its own subset of rheumatoid arthritis. Is that right?
The Raynaud's?
Yes.
Well, it can be a companion to it, I call it, because some people will actually get Raynaud's and experience it but never develop rheumatoid arthritis.
Oh, okay.
However, people that have rheumatoid arthritis tend to report having Raynaud's. And so it was a part of my whole history of coming to this diagnosis actually began with experiencing Raynaud's because there is an R factor associated with it.
Okay. All right. And what would be the typical symptoms for rheumatoid arthritis? Like, is it the same symptoms as arthritis?
The osteoarthritis?
So the symptoms actually, again, back to Mayo, because, again, good resources out there, good evidence there. Rheumatoid arthritis signs and symptoms may actually vary in severity. I know mine did over the course of about 2 years, and they may come and go. You'll have periods of increased, we call it disease activity, which is called flare-ups. And these might alternate with periods of where you don't feel any pain. When the swelling and pain just kind of go away.
That's
over
nice.
time, rheumatoid arthritis. Yeah, it is nice. Trust me, it's totally nice. Over time, the RA can actually cause the joints to deform and shift out of place, like I had mentioned earlier. For me, my symptoms included in the early days before that diagnosis, I had something which is called palindromic flare-ups. And, palindrome is the word that's the same, forwards and backwards. A palindromic flare-up starts where it starts gradually, it peaks, and then it tapers off, and it's, like a sine wave almost.
Okay.
And it started in my shoulders, and they were extremely painful off and on for about 9 months. And then it started to migrate into severe pain in my hands and my wrists, and I wouldn't actually be able to bend my wrists or open and close my hands completely. And I also found that, sometimes normal activities, I'm a very athletic person, like I, played sports all the time. But if I did something that was not really a true injury, like I mentioned, spraining my ankle, if we've ever done that, we know when we've done it. But if I found myself stepping off a curb at a funny angle, and my body would overreact to the inflammation and treat it as if I had just dislocated my hip. And so it was really easy for small injuries to turn into big injuries and big pain, extreme pain.
Okay.
And so when I have these flare-ups, my joints become really sore, and you can actually see redness on the skin from the inflammation itself. And then my dexterity gets affected. Like I get more clumsy with my grip because I can't close and open my hands as easily as I could without a flare-up.
Sure, and I'm sure your gait changes, and whenever your gait changes, then that affects the joints as well.
Absolutely. Yep.
Yeah, I know how that is. What, if anything, can you do to alleviate the symptoms when you're having a flare?
Well, I found a lot of things. Of course, when you're experiencing chronic pain like this, you're always searching for solutions, and trial and error kind of comes with the territory. Unfortunately, the flare-ups can be so severe that, normal over-the-counter medications just are not strong enough for it. So in my years with the disease, I found that one was that when I had an extreme flare-up, actually exercise actually did quite a bit at alleviating the symptoms, especially when I was having these palindromic flare-ups in my shoulders. And I know it sounds counterintuitive at first to move the joints when they hurt, because that's the last thing you actually want to do. But getting that blood flow and the endorphins in the body actually dramatically affected the feeling of the pain. Even if it didn't really stop the progression of the flare-up, I just kind of had to ride that palindromic flare-up all the way through. I also know that some people can feel better with hot compresses for comfort, but what I had found for myself was that I preferred ice cold on my joints and wrists when they hurt.
Okay.
And like I said, I discovered that through a course of trial and error to see what ultimately felt the best for me. So I always recommend that to people. Like, whatever I tell you worked for me doesn't necessarily mean it would work for you.
Oh, sure.
Amee, Lita and I studied therapeutic recreation in graduate school, and it sounds like a lot of the things you mentioned, that they're often used as modality tools to improve range of motion. A couple of questions for you. One, have you ever considered scuba diving? And two, I'll explain.
He has a reason for asking.
I do. And two, when did you first start noticing your symptoms?
Well, first, the scuba diving, no scuba diving for me, thank you. There's only one fear I have on this planet, and it is deep, dark water. And I can't even look at the deep end of a swimming pool when I'm underwater without getting the shivers. So
okay. we did an episode. We did an episode on phobias last year. You'll have to watch that or listen to that one.
Yeah. No, so thank you, no. But as for the symptoms, what is funny is that, I mentioned earlier that I first experienced Raynaud's about 3 years before my diagnosis, and my palindromic flare-ups happened about a year before my diagnosis. But at that time, I had no idea that they were actually connected to the disease progress until after I received my diagnosis. But when the inflammation, pain, and the joint movements became so severe that I took the next step towards getting my diagnosis, it was about the spring of 2013.
So it took you how many years to get the diagnosis?
It took about 3 years of these unusual body symptoms starting to come into my life before it progressed to the point at which the pain was now affecting me daily, and I became concerned that that this stuff was out of range and out of character.
Sure.
Because when I had the palindromic flare-ups, because again, I'm an active person and I do a lot, physically, I was confusing those for just shoulder injuries, that what I was experiencing. Right. But then when it went from my right arm, which I'm right-handed, to my left, then I started to get curious. But it still would take several months before that became something that I carried in with me to a doctor and was able to say, listen, I have this happening as well as this, and now I believe they're connected. And then we were able to start to do the testing.
Okay. Oh, testing. What kind of testing is there to diagnose RA?
Well, there's a lot of different tests that people use. People with rheumatoid arthritis often have an elevated intrasite sedimentation rate, or an ESR or SED rate. Or they'll have C-reactive proteins, which may indicate the presence of some sort of inflammation that's going on in the body. Other common blood tests look for the rheumatoid factor, or the RF factor, and another test called the anti-CCP antibodies. And doctors sometimes also might recommend looking at X-rays and or MRIs to see whether or not there's any progression, like seeing the changes in the joints, like I described, that can actually happen. For me, when I first began experiencing the Raynaud's years before the palindromic flare-up, I went into just my general physician, and they gave me the RF test, and it came back negative, like it was normal. And so they didn't know what was going on.
Yeah.
And then in 2013, when the joint pain and flare-ups were no longer going away and were now an everyday part of my life, I again went back to my general physician, and at the same time, they did the same test, that RF test, and it came back normal again. But she referred me to a rheumatologist, and it was the rheumatologist that gave me the anti-CCP, and the results were off the charts. So it was clear that that's when that I had the antibodies in there and was fighting this inflammation. And so that's when the diagnosis came. And so the RF test works, but it may give you false positives, or false negatives.
Okay.
And so it's always a good idea to continue to take several different tests to measure the markers in your body.
Sure.
Amee, now that you and your healthcare team know what's causing your symptoms, what type of treatment protocols have they been prescribing for you?
Well, originally I was placed on methotrexate, which is very common with rheumatoid arthritis. It can be very effective at treating people, but one of the things that can also happen is methotrexate can also have a lot of side effects. And for me, the side effects were just too overwhelming. There was a lot of nausea, a lot of feeling really sick, and it's kind of like you're trading one problem for another problem.
Right.
And it never fully controlled or managed the symptoms that I had. And so I made a choice to stop taking any medications for about a year. And I tried doing the NSAIDs, the naproxen sodiums, the nonsteroidal anti-inflammatories. And I actually also, in Washington State, medical marijuana is legal. It's legal in more ways now. But using that as a way of being able to get through the palindromic flare-ups. And then I would go in and have cortisone shots when I was having a particularly painful flare-up. But when I changed to a different rheumatologist and we did X-rays, they noticed that I was beginning to show the joint deformation. It was very early stages, but it was beginning to happen. Okay. And my new doctor really encouraged me to take a more aggressive approach. And so that's when I started on Humira, which is a disease-modifying anti-rheumatic drug, also called a DMARD. And after that, my life changed. The symptoms went away immediately, and I got to come back to my original person, who was the active athletic person and didn't have to worry about stepping off the curb and spraining her hip.
Nice.
Yeah. But after 2 years, and this can happen with people with RA, is that the drugs may stop working. And so after a couple of years, Humira began to lose its effectiveness. And so we changed up our plan again. And so now I take 2 oral medications, leflunomide plus Xeljanz. And I also began to notice, as we talked about on the other episode, that my flare-ups also tended to coincide with external factors, such as stress. And so what I have combined with my medications is somatic and cognitive therapies, so that I'm kind of addressing my body overall from an overall mental health and wellness, a bigger, more holistic approach.
Right.
That's good. Does anybody else in your family have rheumatoid arthritis?
Nope, I'm the only person in my family with it.
Actually, I should have started out with, do you have any brothers or sisters? Because if you're an only child, that would be kind of hard.
I do. I have but nobody, back at, as many generations that I know of on my maternal and paternal sides have rheumatoid arthritis.
Okay.
And are there any other conditions associated with RA?
Yeah, there are. Like I said, it's a pretty complex disease. You can get osteoporosis, which is in my family. I come from a thin, frail, white woman background, which we tend to be the higher risk categories. And so sometimes the medications that you take, for example, steroids, can actually increase the likelihood of gaining osteoarthritis. So that's why it's important not to rely on steroids to control the pain, especially if you have family history of osteoporosis.
Okay.
You can also get rheumatoid nodules, which are the bumps that maybe you've seen on joints. And that forms around all the joints. And they can actually form in other parts of the body, not just the joints, including your lungs. Dry eyes and mouth. Some people are susceptible to developing that. Infections are something that we always have to be on guard for, because the medications that we take, for example, methotrexate, is very much like a chemotherapy medication, and its intention is to somewhat weaken your immune system so it stops attacking itself, which means then you're prone to possibly getting the flu or pneumonia or anything else like that. Some people might have, abnormal body composition. They might have more fat to lean than somebody that doesn't. Carpal tunnel, of course, as you can imagine, I have experienced that occasionally because of the wrist pain. And then heart problems. Our rheumatoid arthritis can actually increase your risk of hardened and blocked arteries, as well as the inflammation. Again, that can go throughout the body around the sac that encloses the heart. Lung disease, and even, the scariest one, I think, for most people is lymphoma. Rheumatoid arthritis can increase the risk of that, and some other cancers of the blood system.
Wow.
Yeah. So, and that does make it really unsettling for people when they get their RA diagnosis. For me, I've never smoked. I've always been athletic. And so I don't have any of those additional effects, at this moment in time. And I feel pretty grateful, honestly, that despite taking medications that can weaken the immune system and our body's ability to fight off infections, I'm still pretty cold and flu resistant, like I always was before.
Good.
But my family does have a history of heart disease and cholesterol problems. And so I'm 47. So, that's an age at which we have to start caring about that a little bit more. And so along with monitoring the disease itself in the joints, my rheumatologist and I are also monitoring, cholesterol levels and other things that could be side effects, or leading into side effects.
Sure,
Yep.
Absolutely. I mean, you've got enough going against you the way it is. You don't really need anything else.
Right.
So have your friends and family, have they helped you through the journey with RA at all? Do you ever need additional assistance in things like shopping, anything, like doing anything physical, or are you pretty much, doing everything on your own still?
In the early days of the diagnosis, and for that year that I really wasn't, treating it aggressively, it was really difficult. And so, this has been a pretty solitary journey for me. I was in a relationship during my diagnosis that was unhealthy, and is a part of my overall journey. And so I wasn't getting a lot of help at home. So I had to hire somebody to come in because I couldn't do things like the laundry.
Right.
It was hard. It hurt to pull wet clothes out of the washing machine and put them into the dryer, and groceries and all those little things. And if I bumped my hand up against the kitchen counter in a funny way, I would just be brought to tears. And so I did bring in somebody to give me a hand with that. She worked for one of my businesses there. But, that's also why I chose to add in my mental health component, because when you are dealing with a lot of this pain and a change in your lifestyle, it can have an effect on your mental health, as you can imagine. And so that's why it's an important part of me. But it also helps me build a better network around me of people that have a greater deal of understanding. But I consider myself extremely grateful. I know people that suffer from this disease a lot, and it really has changed their life. And I'm grateful that that's not my case right now, and that I am able to live almost a normal life, except for the fact that, I take over $5,000 worth of pills every month, and have to be a little bit more mindful of certain things and activities that I do.
Wow.
That's a lot.
Overwhelming.
Yeah,
Overwhelming. And the problem is when you're dealing with something so overwhelming, not only is it a lot to deal with emotionally, but you're dealing with the physical effects as well. So I'm glad that you have that mental health component, because how else would you be able to balance everything?
Oh, right. And like I said, living with chronic pain, and that's one of the things that makes rheumatoid arthritis, and so many of the other autoimmune disorders that people have out there, is that you learn to adapt and live with pain every day. And a lot of people don't understand that adaptation takes a huge strength mentally to get to that place. And before you're able to get to that place, you have to work through a lot of stuff. It was, like I said, as an athletic woman, it was really hard for me to stop playing sports. And that's when my rheumatologist, my new one, looked at me and he said, "You're too young to quit now, so don't give it up, get serious." And I had to ask myself at that point in time, do I want to have more quantity of years in my life, or do I want to improve the quality of the years in my life?
Mm-hmm.
And that's why, and that's what I talk with other people when they get their diagnosis, is that sometimes the medication can seem scary because there are a lot of severe side effects that can happen with it. They are rare, but they can happen. But after I switched over to taking Humira and noticed the vast improvement in my life, it was like, well, I don't know how much time I have on this planet anyways. There's no guarantee, right? Doesn't matter if I have a disease or not. None of us know.
Right.
But I do know I love my life, and I do know that I want to continue to be active and to be able to climb mountains for as long as I can. And I will never be able to do that if I disregard, taking the steps that I need to do. And but you have to go through that mind shift, of being ready for that. And so mental fortitude is a big part of this, of learning how to live with this on a day-to-day basis, especially if there's that layer of pain on top of it.
Yes.
And it's tough.
Have you found any support groups, Amee, either online or in your hometown?
Yeah, that's a great question. And the funny thing is, and I mentioned this on the other episode we talked about, my whole personality is really to be healer. And so what I have found is that I have become a support group mechanism for a lot of people. I get personal messages from women that, get diagnosed with RA, and somebody tells them about me, and, I become a pep talk for them. Mm-hmm. There are groups out there for people to connect with each other, and they can get information from one another, and they can be really effective, not only from the helping support each other through the mental aspects of it, like we talked about, this change in life, right, but also providing really good information about what it's like to take certain medications and certain treatments and what to expect when you go through there. And so they're out there. I'm involved with a few healthcare advocacy platforms, patient platforms. And in order to be able to do that, to be able to share my experiences with other people that are trying to figure out their journey and how they're going to integrate this into their life.
Okay.
What additional advice do you have for our listeners and those who may have recently been diagnosed with rheumatoid arthritis?
Well, the first thing I'm usually talking to somebody about is to tell them that it's okay to be scared and uncertain and sad. Those are all normal reactions to getting a diagnosis like this. The drugs that are recommended have potentially scary side effects. The life you knew is going to change, and that's scary. But try not to let that fear stop you from making really good choices, and don't let it coax you into taking well-meaning but bad, non-evidence-based advice from friends and family and strangers, which,
right,
I get a lot of. And that's why shows like what you guys do are so invaluable.
Well, thank you.
Yes, we appreciate that.
We try. Have to give everybody a platform. Thank you very much, Amee, for joining us. And how can our listeners find out more about you particularly?
Well, I have my podcast, One Broken Mom, which is, talks about mental health, parenting, and self-improvement. I have a website, ameequiriconi.com, where you can actually connect with me there directly. And on that, you'll find the links to all my social media accounts, which is Facebook, Instagram, Twitter, and a YouTube channel. Part of my episodes do touch on the connection between mental health and RA. Because I have done a lot of exploration of my own body, my own symptoms, and so I do talk about the disease in particular. And I'm also there as a resource. People can always email me if they have questions. I'm always available that way.
Thank you so much. Thank you. If our listeners have any questions or comments about our show, they can contact us at PodcastDX@yahoo.com, through our website, PodcastDX.com, on Facebook, Twitter, Pinterest, or Instagram. And if you have a moment to spare, please give us a review wherever you get your podcast.
As always, this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider and ask them any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.